The histamine response is what we really focus on. Histamines are going to act in two different ways. They're going to act on our respiratory system one way. They're going to act on our vascular system another way. Our vascular system, it's going to vasodilate and stimulate vasodilation, which is then eventually going to cause fluid leak or fluid creep, right? And it's going to cause edema. So we have now a very wide open container, the same amount of volume we had previous in the very beginning stages, but we have a container that is super wide. In contrast, it's going to cause vasoconstriction of our respiratory system. It's going to cause edema and swelling to our glottic, our tongue, our lips, our eyes. That's where you're going to start having that progressive worsening where you could have stridor and complete airway occlusion.
But I guess how soon should we, if he's going to be anaphylactic, how soon can it happen? Like from bee stings versus like a food allergy or something like that? Are we talking minutes? Are we talking an hour?
So I know of a case, and I know it personally. A colleague of mine had a close friend that I don't remember how it exactly happened, but it was a latex allergy. And from the time of contact, they found her with the EpiPen in her hand, and she was deceased. Like she had complete airway occlusion within the time that she got her EpiPen out. She couldn't even give it to herself, right? And she passed away. That is not going to save the patient, and we should be immediately going to our epi, right? And we know that it's changed. Do we give sub-Q epi anymore?
I do not.
The answer is no. Answer is no. We've seen a lot of changes in this area, and so really the thought process is, and it makes total sense. You need to give your epi as deep and in a place that has the most blood flow, and that is the anterior thigh. And so we need to be given our 0.3 to 0.5 milligrams of 1 to 1,000. If you carry an auto injector, then whatever is in that auto injector from a dose standpoint. But really from an adult standpoint, adult male, if you have a smaller, petite, 100-pound adult female, I'm probably going to go 0.3. But you and I, we're going 0.5, right? In an anaphylaxis, there's no reason that we should not be going 0.5, and I'm reassessing that patient every 3 to 5 minutes, and I'm going to redose. And we got to continue to think about continued resuscitation in these patients. It's not a decision that should be taken lightly, but I think I see more issues with whether you're talking about paramedics or flight crews or whoever you're talking about, military, maybe being a little too cautious and having that inaction.
Yep.
Sometimes inaction is not the best approach. I think sometimes it is, but in this situation, I think you got to be very direct in what you're wanting to accomplish and accomplish it.
Yeah.